So I want to welcome everyone here today. Thank you so much for coming. I know sometimes it's hard at the end of the evening to join onto a webinar course, but trust me, I think this is going to be valuable for you. We've got 3 weeks of this of learning from Dr. Zulia Frost about the InterX, how we use it for the management of acute and chronic pain, how we also use it in neuropathic pain, and some of the results that we do get, some of the really good results we get from with patients with neuropathic pain, and in particular neuro patients. So without further ado, I'm going to let you take over, Zulia, and then I'll mute myself. And if anyone has any questions, please put it in the chat or wait to the end of the session. Okay, thanks.
Thank you so much. Thank you so much for joining me today. I am really excited, really excited to meet you all and pass you my experience using InterX. I have been using InterX for almost 30 years. So the technology behind it and the device itself. So a lot to learn. I learned all my mistakes. So I want to teach you how to not make these mistakes which I made and how to get the best results with your patients. So today the material is quite intense. There is lots of slides, but I want to start first with introducing a theory behind to understand better what are we doing actually when we stimulating our patients with using this electrical neurostim device, and what sort of body response reaction. So let's look at the physiology first, and then we look through physics of the device, and then we start talking about how do we actually treat, what do we do, what the techniques, protocol, and I share with some clinical research as well. So this is a plan for today. If you look through my presentation, that's what's going to be for today. The next session, we're going to focus more on practical. What are the techniques? What are your tools? And your tools will be, of course, to use device, accessories, and you need to know when to use these particular techniques, when to use others. And I share with my case studies for acute chronic pain management. And on the week 3, we go into more at depth to understand about how to manage neuropathic pain, very complex, very advanced techniques, and also I share with case studies. So at every stage of the training, your questions are welcome because it's essential. So as we agreed, let's put it in the chat, and at the end of the session, we go over this. But if you want to contribute to these discussions, please unmute yourself and just step in, and maybe you have something valuable to say. I would appreciate that. Okay, so if you're all happy, let's start. So first of all, the device is, as you know, this InterX device. It's a device class 2, which means it's really safe, very safe, and it works off the battery. And it's designed for relief of symptomatic chronic pain, chronic intractable pain, and adjunctive treatment to acute management post-surgical, post-traumatic pain. So we can use it actually in any pain conditions. So we have the device range, professional, personal, which you recommend to your patients to use, and accessories. Accessories, flexible arrays, which allow you to use device unintended, and then also in difficult to reach areas in the body. Soft tissue release to release fascia. Small cosmetic electrode, which normally we use on a very, very tiny part of the body. Classic electrode, which is for smaller, like joints part. Comb electrode for working through the scalp and dome electrode when you work on the massive areas of the body. Here they all are for your information. So let's look now what is actually therapy InterX delivered. So InterX delivers non-invasive interactive neuromodulation. Okay, let's decipher this name. This is really mouthful, but it reflects exactly what it does. So we produce form of electrical pulse stimulation. And this electrical pulse stimulation is limited to cutaneous layer of the skin. So because you stimulate just basically skin level, you do not, like TENS devices, you do not go through all the levels of the skin. The mechanism and delivery is different. So in this case, lots of different nerve endings located at the level of the skin. So therefore you create neurostimulation. You stimulate the fine nerve endings in order to send information to the brain and central nervous system. And this is all combined with bioimpedance feedback. So we're going to talk about bioimpedance feedback in a minute. And this enables these high therapeutic results, which you see in practice. So effectively, if you ever describe this technology, you have to describe in terms of two concepts. One concept is actually neuromodulation. Although you stimulate the fine nerve endings, yes, you create neurostimulation, but it results in stimulation of the all parts of the brain, and particularly you stimulate hypothalamus, for example, which is a part of autoimmune regulation. So you mediate the responses from the central nervous system, but these responses are aimed at restoring homeostasis. Okay, so the second concept is bioimpedance feedback. But what is bioimpedance feedback? So we understand that the skin has electrical property as well as any other parts of the body. And when your skin impede electrical current, which you apply to the surface of the skin, but at different places, it impedes differently. And this skin impedance changes in response to neurostimulation. So bioimpedance feedback is the concept which actually enables you to automatically adjust the level of stimulation to each patient. So in a sense, the patient's body, patient's skin will allow stimulation from your device or disallow that. So in a sense, it's not you who is controlling this stimulation. It's a patient's skin control the output from the device. This is really different to what other modalities offer for you. In this case, it happens automatically at any moment of time, and it's not conscious. You don't need to tell your patients, think of the quiet sea, think of the nature. No, you can talk and chat about anything else. It will happen at the level of the skin. But I will explain this concept a little bit better as we go through it. So bioimpedance feedback, we talk about this. Skin impedance changes in response to neurostimulation dynamically, enabling dose stimulation in real time. What again it means? It means that your device will give exactly amount of energy input in the system, which is sufficient to stimulate fine nerves. It's not going to overload this stimulation, and it will be happening at real time. So the skin impedance drops, current is allowed into the system, I call system the organism or human body, and skin impedance goes up, it disallows this current to get in. So you understand now, it's happening dynamically at the real time. So if you look at the actual impulse what InterX is produces, it's like this. So you could see how dynamically changes the amplitude of the impulse and how constantly changing all these parameters, the train of the stimulation. And when you hit the right points, which becomes very conductive, like here, so the input is diminishing. So it adjusts to the conductivity, so you don't destroy and damage the patient nerve ending. So because of this, you have a variety of benefits. So right now, look at the concept of neuromodulation. So this is for your information, just with visualization parts of the skin. Yes, you have epidermis and dermis. Epidermis, it's really covered with phospholipids and fatty tissue. So, and dead skin tissue. Yes, what is to you in regards of electrical current? That means that at this level, you have hard for electrical current to get through. However, once you overcome this initial barrier, the electrical impulse travels through the very hydrated dermis, which full of sweat glands, blood vessels, and this exhibit much better conductive property. Okay, so in this case, the electricity has to do the work to go through the tissue and then will be conducted through the connective tissue underneath. So in the skin, a stimulation limited to and targeted to the skin, and it's primarily going to target A delta, A beta, C fibers primarily located around the inner organs. So in our work, you're hardly going to be stimulating C fibers. And for that, you need a lot stronger input. So in our work, we target A delta, which are pain receptors, but also itch and temperature receptors, and A beta, which is faster, is responsive to touch, pressure, vibration. And please note that these type of receptors we target when we deal with neuropathic pain. Touch, pressure, vibration. That's why we set the device to vibration level. And when we said to stimulate A delta, we set device to more prickling and tingling level. And this diagram represents the InterX device like this, and the skin is like that, yes? So what you could see here in the middle, it's the inner ring electrode, and then you have outer electrode. And this is your epidermis, and this is dermis. So you could see there is a resistance to get through the first layer, yes? So because of this resistance, some current is going to flow right through the surface of the skin. But then some current gonna get through this resistive area and get very conductive and join the inner electrode. In this case, there will be a difference of the current running through the surface and current running through the skin. And that's what you're going to see on your screen as a number, okay? The difference. The bigger the number, the bigger the difference. The more conductivity tissue you have. And that's where our preferred areas for treatment. So what eventually is going to happen? Neurostimulation, neuromodulation concept. So you stimulating at the skin level this A delta or A beta fibers or tiny amount of C fibers, yes? So the information from this neuron goes to the dorsal horn of the spinal root. Primarily, you stimulate A delta, so this pathway will be activated, yes? And then pathways go spinal methalamic, but mostly spinal reticular pathways we engage when we stimulate with InterX. So you get to brainstem, midbrain, thalamus, cortex, okay? At each level, even at level of the dorsal horn, the body will release certain amounts of endorphins and regulative peptides. Yes. So this is what brings for you patient pain relief. But ultimate goal of this therapy is to deliver information to the cortex of the brain, because cortex is your decision-making part of the brain. And from there, you get centrally mediated responses. What does it mean? It means when you stimulate with InterX, if you see vasodilation effect, yes, pink skin appears on the skin. This is not through direct stimulation. It's through decision-making cortex, telling the body, release bradykinin and dilate blood vessels, yes? So we engage central nervous system in assisting in our healing. So these responses, actually, they are non-linear, yes? Because it's like simultaneous. What second diagram would represent this concept. So when you stimulate, look at this. This is the pathways we just used. It's here. We stimulate dorsal horn, thalamic spinal reticular, then it goes into different parts of the brain, different nucleus, hypothalamus, and then higher brain, yes? And the response goes through, first, you're going to send sympathetic response. So the patient immediately feel like, ooh, a little bit hot, heartbeat, and the sympathetic ganglia is activated. Followed by, in about 10 minutes, you get parasympathetic response. Parasympathetic response associated with relaxation, slowing down heart rate, and reduction of blood pressure, yes? But it's all going to be self-regulated and small, not like dramatic, anything like that. But the idea is to produce both responses. In addition, because you stimulated the hypothalamus, thalamus, so you have also release of adrenocorticotropic hormones, different hormones which activate the immune system, and then subsequently in the blood release various neurotransmitters, cytokines. You activate your endocrine system, noradrenaline released, cortisol released, and there is a loop. They're constantly talking to the brain. So you, in effect, activate your own body signaling system, which spread beyond the nervous system. It spread to the all other system which our body employs when it deals with a problem. So also please notice, when we stimulate with InterX the skin, it's noxious signal for the body. So the body reads it as a danger, okay? So it responds in a complex way as if there is a danger. So in effect, we mimic the damage, although we're not making any damage, but we mimic because electrical current is not usual thing on the skin, right? So by doing this, you, every time when you stimulate, you kick the body to multiple responses. You kick the body's all the neuropeptides, enzymes, different hormones. The body releases endorphins, everything. So you stimulate the response from the body collectively. And that is how you treat. You treat when you stimulate with InterX, you treat through activation of body resources, okay? So after each session, you should see the difference. Now, let's look at the different revision physics of the device, yes? So when you look at the physics of the device, you need to understand first what is electrical current, yes? So current is the flow of the electron, charged particles, yes? And it can be direct current, or you know it as galvanic current. You can also have current which is alternating or Faradic current, AC, or it can be pulsed current. So three types of currents. So direct current, you could see here on the diagram, and you could see how it flows in one direction, flow of electron. Supposedly, nobody's seen the electrons, but it flows from a negative to positive, yes? with this, you should understand one important thing. So under the electrodes of the InterX, you're going to build up charge. And this is really, really important. We're going to talk about this concept a little bit further, but just remember, direct current builds up charge for you. So alternative current, it's when electrons flow in one, they're constantly changing. Yeah, effectively, sinusoid current is alternative current. Yes, so the particle flow in bidirectionally. And when you do this, the charge is propagated. It's not accumulated underneath the electron. This you need to understand. So pulse current can be direct or can be AC pulse current, yes. So various, it could be different shapes, like a saw, like a wave. So this particle periodically change. But what is interesting that InterX employ this pulse current, and it's got both AC and DC, and you can see it here on the diagram. So you could see it flows in one direction, and then you have direct current. This is microcurrent, this is direct microcurrent, yes, a little bit step up, and then you have AC, you can spring. This is a shot when you just stimulate the air with the device. The minute you put it on the skin will absorb or dump the signal, and that's why you could see a different train of stimulation, yeah, changes. And this is what software is picking up, the change. And when you hit the right spot to treat, it changes again. And you can see it's kind of diminishes, yeah? Why? Because we don't want, when we have a highly conductive tissues, we don't want to overstimulate them. So it's adjust dynamically to the level to give sufficient stimulation, but not overwhelm. So nerve endings are still intact. They're not damaged by the stimulus. So additional pulse characteristic we look at this voltage. It's very, very important in our work. Voltage, it's charge across the membrane, yes? So you can see when nerve tissue conducts electrical impulse, it's propagate the charge by changing the ionic, but it's sending like a gossip along the axon of the neuron, yes? And this charge, the bigger charge, there more vitality in the body. So currents, it's a rate of flow. I always tell you, please look at the current as if it's a water, yes, like water flow. The water flows always finding their own path. It's a flow, it's got a flow. And so interesting to know that when we increase voltage or potential across the cellular membrane, the current increases, yes? So the strength of the current goes stronger. We decrease voltage, there is a decrease of current. This has also clinical meanings, so I want you to remember this. Cellular membrane typically in a normal state has negative charge until it starts conveying the impulse, yes? And membrane change in membrane potential elicit an action potential. So action potential conducts that current. The more voltage across the cellular membrane, the more current flow, the healthier the cell, okay? Voltage equals health on a cellular level. So if people suffer with a low voltage, their cells become ill. Current density, another thing we're going to talk about. Current density, it's how have concept of the jet and shower. Yes, with the shower, it's more or less distributed. With the jet wash, it's in one specific point. So this is where the current dense. Accommodation, it's accommodation of the nerves to stimulation. And modulation. Modulation, it's a various one of few parameters to also prevent adaptation and introduce change. So we just mentioned about the impedance, and I told you impedance to electrical current. Please think of this as water. Yes, current always take the path of least resistance, just like water, just like like Niagara Falls, for example. Yes, the water will be drawn to low impedance. So this is a piece of the skin, and researchers put a circular electrode underneath to change the skin impedance to make it low. So what is happening now? All electrons flowing towards a low impedance, yes, towards this lower, as I described, it's just Niagara Fall. You could see this Niagara edges, and the fall of the river is inside. It is very interesting because in Chinese medicine and acupuncture, in the ancient texts, they describe human body as also in terms of water. Like they say, we have a sea of qi. So the energy, we have creeks, we've got rivers, we've got springs, and it goes from their end points, like the area is flowing, the little creeks turning into springs and turning into rivers and turning into lakes and seas. Decreased resistance means increased current, and increased resistance means decreased current. The more tissue holds water, the easier for current to pass through. And here I want to tell you, children, they contain in their skin lots of water because they've got hyaluronic level is very thick. Yes, so actually children have overall lots of water, and so that means they have very active flow of electricity through the body. And current passes through this body a lot more easier. That's why treating children is very quick. And then if we talk about the elderly, and elderly people have very dry skin, right? Why? Because hardly any hyaluronic left. Their colon is not functioning well. They're not conserving water in the body. They are dehydrated by default. So that's why a very little current passes through all the body, and that's why healing or results from your stimulation will be less apparent and takes a longer time. So bioimpedance, actually interesting concept, biological impedance compared to ordinary impedance. Biological impedance, it's a combination of parameters. Like we talk, first layer will be resistive, then second layer conductive, and then with direct current, microcurrent in the part of the impulse, you accumulate the charge underneath the electrodes, yes? So that creates capacitance, how much energy you hold in that part of the skin. So this is all parameters monitored simultaneously in real time by software in the InterX device. And that's why, and then it produces for you the number you can judge. So that's why when you use an InterX device, you can actually watch these parameters in real time and make your clinical judgment. So, for example, tissue states will change this bioimpedance. So when impedance decrease when there is an open wound or abrasions. Yes, exactly. If you put the InterX on the open wound, you'll scream because even 2%, which generates a default, is really strong because conductivity will be through the roof. And if you put in the area of the where impedance increased or decreased conductivity, this is scars. This is when condition associated with ischemia, arteriosclerosis, or denervation. Then you have to crank it up high because it's not conducting very well. And interestingly enough, all the points of low impedance where you have decreased impedance, yes, they associated with very interesting points. Like in acupuncture, the painful points, Ashi. Trigger points have decreased impedance, nerve junctions. So these are important points for us to find and treat. Now let's talk about concepts. You probably never heard of this before. If you heard, you know, high five to you, because nobody talks about this, and yet it's so fundamental, so important to know that the body cannot heal without energy. Okay, the body can only initiate healing responses if you have electrical flow, if you have electrical charge. So the body produces so-called current of injury, and it can be initiated in any tissues in the body. So this is a demonstration of this concept on the skin. So you have broken skin. Immediately, the flow of the electrons create a pool, a vortex, a negative current. And this negative current starts attracting charged, positively charged cells. So in this case, look at this, leukocytes, various cells of immune system, fibroblasts, to cells to repair the damage, all sorts of things. So they being physically attracted and they physically crawl to the site of injury. This can happen not just in the skin level. It can happen in ligament tissue, in muscular tissue, in heart tissue if you have infarct myocardium, in ulcers in the tissue of the digestive system, etc. So the research team Watson, 1995, look, it's not new. It says a trauma living matrix generate current of injury in bone, skin, nerve tissue. But actually, further in years, they prove that it's in every tissue. Injury to a living system initiate a series of complex electrical currents at the site of injury. Local current of injury is primarily responsible for the appearance of new cells. So you create faster regeneration of the damage. You create proliferation of new cells. There is both AC and DC currents detected at the injury sites and resulted in reduced healing time. And guess what we deliver with InterX? We deliver all of it. So we actually assist electrically for this healing time. Cellular proliferation, galvanotaxis. Galvanotaxis is when the cell crawling physically based on the electrical charge. Preferential growth with neurons, all of it happening at the site of injury. External electrical stimulation, that's what we do. We have external electrical stimulation. This is talking about the wounds, produces effect that can jumpstart the healing phase. So I look at the InterX and I think of the defibrillator. So basically, plus and minus, you put to the skin, you charge that part of the skin. So the question is, how is it being from the surface of the skin delivered inside the skin, inside the body? Well, remember, we just talked about the concept that current gets through the resistive area and then conductive area of the connective tissue of the skin. And remember what's happening there. You have cytoskeleton, intracellular, extracellular, extending, creating a network, fascial network. And this fascial network is actually your conductive medium, because fascia is semiconductive. It's capable of conducting electrical charge. So we create the charge on the surface and it delivered through the connective tissue medium into the where it's required. So what we have with this, we have this advanced neurostimulation, which actually neuromodulation, I would say. It happens with two aspects. First of all, the scientists, the engineering technologies improve their delivery of the impulse. Yes, they designed interactive waveform, which changes in response to the impedance. And as therapists, we immediately saw the opportunity and we say, hooray, we don't need to use gel now to protect the nerve endings. we can use it directly on bare skin. When we use it directly on bare skin, we can scan and find optimal impedance point, okay? So this is the key. So no gel is used and immediately we can scan. We can measure even, yes, when we place the device and we measure this impedance, low impedance point, and we target them and we get clinical resolution. Because we also place in high voltage and high current density parameters on those low impedance points. And low impedance points will help you to deliver electrical current to cells which are flat. They lose in charge. So we send directly that potent current to recharge the cells and get the cells back to life again. And us therapists also found a way how to treat dynamically, because typically standard way is to stick electrode on the skin and keep it there. No, we use our device, we move the InterX, and when we move, we look which direction is most resistance, where the fascia is not conductive, yes? So we then work towards that area to help, to assist physically to create dynamic response. And electrode configuration from technical parameters gave us this jet, very, very strong, potent current, because they brought very close together plus and minus, and this gray area is your treatment area, not the actual stainless steel plates. And of course, we immediately picked it up from clinicians. We thought, okay, we understand how the body works. So we have dermatomes in the body, myotomes, viscerotomes. So why don't we create neurological protocol based on that? We use reflex projection. We can treat reflex areas, hands, feet. We can employ even acupuncture points if you have knowledge of them. We can stimulate them because they coincide with trigger points and neural junctions. So in summary, we can scan, we can stimulate with high density current, we can create actually a better pain relief because we can, as therapists, we can induce different frequencies, yes? We can group those pulses in a 15 pulses per second up to 480. And what science is telling us that if we employ low frequency pulse, we release one type of endorphins. If we employ high pulse, we release, for example, dynorphin, different type of endorphins. So collectively, we increase range of endorphins and neuropeptides. And this is all happening interactively, waveform is constantly changing, and this prevents accommodation to our treatment. So really is an advanced and superb modality. Pain relief happens at every level, starting from cellular level, where we optimize energy production, ATP, we increase microcirculation, we stimulate the release of cytokines, but not locally. Typically, it's through the central nervous system. We activate fascia through fascial meridian network, through microcurrent, and we activate a neurological network. We stimulate A beta, A delta fibers, inhibition at the dorsal horn, hypothalamic pituitary gland activation, and autonomic modulation. All that will give you release of endorphins and regulated peptides. Now, quickly look at through these studies. So this is a summary for the studies you're going to study, self-study. So this is, please look, many of them available. If you find something unavailable and you don't want to pay, reach out. I have a copy. Okay. So clinical evidence is it started off treating pain in severe orthopedic patients. I give you studies in chronological order. Yes. So first study was done just to verify that InterX can produce pain relief. And it has been done at the hospital in Texas, and a group of very severely ill patients were chosen, and they were given just 3 days of stimulation with InterX consequently, and the recorded range of pain. So pain initially was 6 in average in all patients, and it dropped to 1.2 after 3 days stimulation, which was approximately half an hour. So very, very dramatic effect. That brought attention to researchers. So they said, okay, we could actually do further studies. So the first study was done in Russia. Why there? Because, you know, my connections. And in Russia, although it was done in Russia, it's done to very, very high standards. It was in a very prestigious hospital. And the study was done on the measuring recovery, post-surgical recovery after hip fixating surgery. And at this study, we measure pain score, and also we measure the range of motion. Range of motion, how free after the stimulation the hip joint was. And this study was with control group, because first was just explorative. 30 in active with InterX and 30 in control group. And you can see they started together with active group and sham group, even higher score in active group, yes, but relatively the same. But even after the first day treatment, you have already drop in pain overall by 4, whether in control group it's still 7.5. And so patients receive also, by the way, standard medication treatment on the background. So we just added as an adjunct to standard treatment. And then you can see by day 5, there is no pain. In average 0.5, it's no pain, yeah? Whether in control group, still 4.1. So in the same way, it progressed range of motion immediately in InterX group improve. 50% by day 5, 90, literally patient left the hospital without any limb. So very good study, which prompted another study to use on the ankle, postoperative ankle injury. In this time, we wanted to know, would it affect in the actual inflammation or not? So we asked researchers to measure the swelling, the edema of their post-operative ankle, and it was compared to the normal ankle, which wasn't operated. So they took the tape measure and measured this. So same 30-30 group, and you could see this is active. So they measured edema before application of the InterX and after, day by day, and they could see the swelling is actually really reducing compared to the control group. The other ankle was staying the same, yes. And to control group in control group patients, not the difference between healthy ankle and the post-operative was recorded in numbers. That's where it comes here. But this is a different group of people who did not receive InterX treatment. So pain relief was exactly mirroring the inflammation reduction, and you could see even more profound pain relief, yes? So it was to proven actually against control group that InterX can reduce pain and it can reduce inflammation. And this is a treatment study which I have been involved as well. Personally, because I designed the protocol for this study. We have done it in England, in the UK, in the Prince Philip Hospital, and the people had total knee replacements, and we put the electrodes around the post-operative wound, and patients was taken from the operation wound, got in the ward, and then immediately we started stimulating using acute settings. Nurse would come, activate device. Device was always plugged in, okay? This was plugged in all the time. Nurse would come and do it, I think 3 times or 2 times a day. I don't remember exactly. And so what they did, they measured pain response. So no pain, mild, moderate, severe. And so we have also control group, yes? So look at this. This is literally like few days, 3-4 days at the discharge. So they received InterX stimulation and they measured pain. And look at this, 53% of the patient experienced no pain at all. Tiny little moderate pain, 43 mild, 0.23. So basically they were discharged with virtually no pain. And yet control group had severe pain, 8 to 10. Big chunk, yes. Moderate pain, big chunk, and mild pain, 47%. So this is as well proven to be efficacy for pain relief, in this case, acute pain relief. This study has been done in Australia by Bill Walsh, and this study actually wanted to show that the healing of the tissue at the tissue level was optimized when you use InterX device. The sheep were used, and they used to measure to see how much collagen forms. Yes, for this BCNA they use formation, and they look at how many new blood vessels grew. So you could see InterX week 1, you already have collagen aligned. Control, no, not very poor formation of collagen. So repair, fibroblast and everything. And here is a week 4. At the week 4, you on InterX group, you have so much growth of vessels compared to week 4 control, nothing really. It just show you, InterX creates a positive environment for healing because it self-regulates, it optimizes the healing itself. I mean, the device doesn't do it. Electrical current does it, and also engaging the central nervous system in the healing does it. It didn't affect the strength though, you should know. So right now, another study for you, interesting changes on cytokine level with InterX versus TENS device, because people start saying, does it work like TENS? Well, it works better than TENS. You could see that every cytokine released by InterX is more, or reduced is more, yes? So, and you can see, of course, cytokines release at different stages with different patients differently. So it just, our goal was to demonstrate, to compare the TENS, it's much, much more effective. But really the study which put all issue with TENS to bed, it was this study. This study was in Cincinnati University. And first of all, let's look at this diagram. The study participant produced the model of inflammation, okay? And by injecting what is called glutamine and DNP into this elbow area. And then it was stimulated with InterX, and what they did, they measured the respiration rates, like how much active immune response would be for lymphocytes, yes? So it's interesting that, and there is a comparison, TENS unit and InterX, TENS in blue, InterX in red. And it was interesting, the amount of ability of the cell to fight the bacteria was so significantly higher in InterX group. Look, 500% if in case of glutamine. And when we injected DNP, it was still 300% compared to TENS device, you know. So in a sense, both modality work, but InterX far, far superior than TENS device. And this is my also clinical opinion after seeing and treating lots of patients. You can also see the regulative effect, which I mentioned to you. Remember, if you engage your central nervous system, all the self-regulation and healing processes will be happening much more controlled way. So, and you could see on these gene expressions of the this all substances which associate with healing, positive healing, right? You could see different genes, ATP synthase, you know, basically, I don't want to go too much into the neuroscience, but if you look at this, it's the mitochondrial gene increase, mitochondrial gene increase, cytokine, this is cartilage gene improved. And so this is positive aspect. At the same time, this sort of negative aspect from associated with healing, with inflammation, has been reduced. So amylases, cell adhesion molecule, immune cell attractions, yes, yeah. So all these negative processes been reduced. So it proves for you self-regulating effect from the InterX device. And this is also in Cincinnati, it was checking on what's happening after stimulation. Adrenocorticotropic hormone, beta endorphin, dynorphin, leukenkephalin, methenkephalin, everything compared to InterX, compared to TENS device, was better and more. Study with on EEG study, animal study, proved that we have a very profound stimulation on the parasympathetic response, especially when we apply InterX to the head of the animal. Yes, we get stimulation on optic, somatosensoric area, anterior, posterior, hypothalamus, which stands for autonomic regulation. And EEG study using InterX on 6 points on the face and neck, proven to activate brain activity synchronizations in different levels, theta, delta, which means activating thalamic diencephalon structures, alpha, beta rhythm, reduction of tension, relaxation, all been happening. And this is a study on EEG. You could see the patient before stimulation produce very active wave, different waves, alpha, beta, theta, and after one session, how much quieter the brain becomes after InterX stimulation. So this is actually very important aspect, because shouting brain does not allow self-regulation in the body. Quiet brain, it's the same as meditation. The patient, when they meditate, they release, they quiet their brain, and healing happens much easily, readily. And lastly, use of the on chronic plantar fasciitis is an Italian study. The researchers use locally, and they already got significant better result compared with the second group, which was not a sham group, but a group using shockwave therapy. And you know, electric shockwave therapy, it's quite painful procedure, shall I say. So it's much better to use InterX because it's much more comfortable. So the satisfaction score was over 90% when they use InterX device. So this is a great study because I have been asked, how does it compare to this? So what we normally use, we use this concept, scan target dynamic technique, yes? What is, we have a look quickly, choosing settings to treat, and we close the session then. So basic concept, scan target dynamic starts with scan. So when you scan the skin, and when you scan the skin, you look for areas of low impedance, which be representing of the corresponding sympathetic nerve being activated, yes? And you hear the sound disappears. So we scan, we find this area, and then once we find this area of low impedance, okay, you get autonomic response with galvanic response, which will give you tiny increase in sweat secretion, and that a low impedance point will be very obvious for you. So it will create a sticky point. And then you target this area with high density, like a jet stimulation. And when you do this, the central nervous system starts responding, releasing various endorphins, neuropeptides, regulated peptides to heal this area. So end result that it goes back to normal. So high amplitude, high density current elicit central nervous system responses and releasing all what you need to do, and dynamic effectively. And then lastly, we start moving the device over this area. Yes, we start in a different directions. Dynamic movement in the electrode enables work with fascia, working against the most resistant sticky points helps release fibrotic soft tissue. So what we're looking for? We're looking for, when we scan, when we target the dynamic, we're looking for areas of low impedance. And it presents for you by, if you slide it there, you have that sticky sensation. Patient tells you, I feel stronger stimulation. Noise after the electrode disappears. And even you could see local erythema as a result of stimulation appears. This is all pointing for you for this low impedance point. We call them in our jargon active sites. So if you ask me, Zulia, what we do with InterX, we are stimulating to find active sites, the area of low impedance, because low impedance enables us to send current. It's like a gate, open gate, so we can send current to get, it's the best place in the body to deliver current to the damaged tissue, okay? So in this case, when you stimulate, you look for these signs, or you can look for higher numbers because it represents low impedance or active sites or optimal treatment points. It's all the same. And then we target it. We leave the device on this, and it's going to be, tapping. And what it's going to do, this tapping with electrical pulse create a new dominance in the cortex of the brain. And this dominance will be the starting point for your awareness of the problem. Because remember, with TENS device, we block transmission of the impulse into the brain. We say, la, 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 I don't want to hear about this pain. Yes. So we actually protect the brain from stimulation, but the brain thinks everything is okay. There is no trauma, no injury, there is nothing to heal, and it's not engaging in the healing. Whether with InterX, we actively engage your central nervous system. Feedback, it's a multidimensional negotiations and talks between different parts of the systems, different parts of the brain. So we enable healing by doing that. And then we move in dynamically. Then we will move with fascia because it's also very important aspect. Probably 80% of my patients, I would say, associate with fascia dysfunction, because this is create body misalignments, compression on the nerve, compressions on the nerve causing pain, etc. So this is important element. So we cover all of that. Treatment planning. So I'll tell you how we do. We go back to this table at each training stage of our process, yes, because it's absolutely important. This, I organize your thought process, everything in 3 categories. When you deal with acute pain, when you deal with chronic standard pain, and here is your complex pain patients. They may be neuropathic, mostly they will be neuropathic patients, but some of them are not, but their common denominator is they are hypersensitive, okay? So if you want to make clinical judgment, if you want to decide what do I do with the patient, you need to assess patient in these three categories. Is my patient acute? Yes. In acute pain, is my patient in chronic pain, or my patient is hypersensitive? Hypersensitive person could be acute, okay? But when patient says, oh, I can't touch this part, yes, you press on it and they say no, or trigeminal neuralgia, you can't touch parts of the skin, or complex regional pain syndrome, you can't touch the food. If you cannot touch the food, don't use acute settings, go for hypersensitive settings, okay? And then what is acute versus chronic? It's up to 1 month. And I am telling you for simplicity of your judgment, yes? Because, you know, you go into the medical domains and they tell you acute pain is three months, whatever, and then it's chronic. For us, in our work with InterX, up to 1 month acute pain, over 1 month it's chronic pain. And complicated cases always, if you think, oh, my patient is complicated, immediately think, is it hypersensitive? Then use hypersensitive setting. Is it chronic but not hypersensitive? Use these settings. Or is it just up to 1 month? Go for this one. But if it's just for 1 month but display hypersensitivity, use this, okay? There is a little cue for you in type of pain. If people tell you, I have stabbing, sore pain, like acute injury, yes, acute. If it's chronic, it's typically gonna be aching and sore. And hypersensitive typically tell you, I have burning or throbbing pain, okay? So this is helpful for you to understand too. Define your goals. Always define your goals. What you're trying to achieve, just pain relief, or you want to achieve healing, okay? Because you can knock people off just by pain relief, like put on high level of stimulation, and you can reduce pain, but it's going to be temporarily. And then next hours, the pain patient re-inflames, the pain become so strong, okay? So you need to understand what you do. If you really want to make a difference and create a healing, then you need to move, you know, with understanding what you do. Further, when we go through the advanced training, I will tell you a little bit more different strategies. Duration 15 to 20 minutes versus 30 minutes in chronic cases. First day, very important in acute pain. If it's just something happened, if you have access to device 3-4 times a day, okay? If it's a patient come to your clinic, ask them come daily, then you can arrest and very, very quickly recover this patient. But if you miss the first day, it's really difficult to, I mean, the effectiveness won't be so spectacular, which makes people like, wow, what a device. You really need to get that one. Chronic pain, we treat 1-2 a day and hypersensitive once a week. Sorry, 1-2 a week, hypersensitive once a week. Pulses, we'll go through these settings tomorrow, not tomorrow, next session. But this is like your ideas how differently to approach each case, okay? So as I said, we're going to discuss this as we go. And here I'm going to give you a flow chart how to think. If patient has pain, you go here. If patient has pain, but it's chronic, you go through this process. If patient has chronic, but for example, nociceptive, then you go through this. If patient has acute, you go through this, and this is when no pain, okay? So you work through this flow chart diagram when you start treating patients. So I want to stop sharing, and I will wait for you to give me the questions.